Hi, so my name's Bradley. I'm going to be talking about how to um, activate posterior tibialis, specifically activation of posterior tibialis. And it's important to isolate a certain muscle if there's a certain weakness, because if a certain muscle has an injury to it, we want to isolate that muscle, and we don't necessarily want to work on other muscles that may be synergist to that muscle, which then might have to take over for that muscle's primary job. So in the case of the posterior tibialis, it's a plantar flexor and it's an inverter, and we would want to isolate this muscle because say there's an injury or a weakness to it, we don't want to be working on the synergists and experiencing synergistic dominance if this is the muscle we're trying to isolate. So in this case, because we're isolating, we're going just for the posterior tibialis, but if we were going to integrate, we would look at other integration exercises. And so a good way to isolate posterior tibialis is to target its primary, one of its primary actions, which is to invert the foot. And so a good way to do that is to use a band. And you can do this with or without a band, depending on your strength level. But a good way to do it is to use a band and get whatever tightness that you need, and then using the resistance of the band, inverting the foot. So inverting the foot will activate posterior tibialis. And so we're going to do this for 3 sets of 10. So 1, 2, really slowing down that eccentric phase of the action. So instead of snapping backward, we're going to come in slowly, hold it for a second, and then come back out. Invert, slowly, hold it, come back out. And you'll start to feel it on the posterior side of your lower leg. And this is really a good way to isolate posterior tibialis because it's a deeper, smaller muscle. It can be difficult to isolate it when it is such a synergistic muscle, but this is a good way to isolate by targeting its main action of inversion of the foot. So do 3 sets of 10, taking a minute to 2 minutes in between because we want to strengthen the muscle. We don't necessarily want to tire it out all the way and then jump right back into a set. That could really, increase inflammation and really break down the muscle fibers more than we want to. We just want to challenge the muscle in order to strengthen it. And it's important to note that if you have any sort of neuromuscular conditions or heart conditions, it's probably not best to be performing these exercises, although this is a low exertion exercise. In addition to any sort of injuries or past injuries that may prevent you from performing this exercise properly, and also could induce more injury if you do perform this exercise.